My name is Gary Cohen. I'm the president and founder of Healthcare Without Harm. What I want to talk about today is that in the United States, we spend more money than any country on the planet on healthcare, and yet within the social progress indicator, we are at 17, number 17. And we have cancer rates of 1 in 2 for men and 1 in 3 for women. We have learning disability rates of 1 in 8 kids. We have high asthma rates, and our obesity rates and diabetes is approaching 1 in 3 Americans. Why is that? And the reason is that we haven't addressed the environmental and social conditions that make people sick in the first place. And what we need to do to address this epidemic of chronic disease in America, but also around the world, is to move upstream and to make healthy environments, to address the core issues that people face in their lives that contribute to chronic disease, to detox our supply chain, to get toxic chemicals out of our products, to move toward renewable and clean energy that doesn't pollute the air, to create sustainable food systems that provide key food to people to support their health. And so what we're realizing is that if we can take some of the resources that we've spent treating people who are chronically ill and move them upstream to address these issues, then we can have incredible progress on the health of our populations. What Healthcare Without Harm does is to get healthcare to lead by example, to be early adopters of renewable energy, to bring toxic chemicals out of the supply chain, to be early adopters of green chemistry, to serve sustainable and healthy food to their patients and their employees, and to be an anchor in their communities for modeling this transition to a more sustainable economy. And if we can get healthcare to use their purchasing power, use their larger mission of creating community wellness and planetary health, if we can all move in this general direction, then we can change this framework to create more health on the planet. And the social progress imperative can help demonstrate how by making conditions more livable, by becoming more environmentally responsible in our communities, we can reduce chronic disease and illness.